Welcome to the Ottawa Hospital's Joint Replacement Clinic. Today we will be talking about knee replacements. We will be learning about the anatomy of the knee and what arthritis does to the knee. We will explain what both a total knee replacement and a partial knee replacement are. We will explain what to expect when you are in the hospital. We will show you the equipment that you will need to get in advance to make sure you have a safe return home. We will teach you some exercises that you can do now to prepare for surgery. We will explain the physiotherapy plan for in the hospital and for after your return home. Most importantly, we want to make sure that you have a good plan for your return home after your knee replacement. Your knee is a hinge joint between your thigh and shin bones. The thigh bone is called the femur and the shin bone is called the tibia. The kneecap or patella is the third bone in your knee. It rides up and down the front of your knee as you bend and straighten it. The ends of the bones are covered with smooth cartilage. This cartilage protects the bones and allows for smooth motion between them. Between the two bones are two menisci. They work as shock absorbers. Strong bands called ligaments hold the knee together. Large muscle groups control the movement of the knee. The quadriceps are at the front of the thigh and work to straighten the knee. The hamstrings are at the back of the thigh and they work to bend the knee. Arthritis causes wear and tear at the knee. The cartilage covering the bone is thinned and worn away. With no cartilage for protection, the ends of the bones touch. If the bone ends are touching, they will rub on each other when you walk, which will cause pain and inflammation. This is what the surgeon meant when they said your knee was bone on bone. Arthritis can also cause bone spurs to grow. Because your knee is painful, when you stand on it, your body grows some more bone to spread the forces out. This extra bone is called a bone spur. Bone spurs cause pain when you try to move your knee and they can block your movement. Here we see an X-ray of a healthy knee on the right and an arthritic knee on the left. In a healthy knee, we see black space between the bones. This is not empty space, it is your cartilage. Cartilage does not show up on X-ray, but if we see the black space, we know the knee joint has lots of healthy cartilage. In the X-ray on the left, there is no space between the bones, and so we know that the cartilage has been worn away, leaving bone on bone. In knee replacement surgery, the damaged cartilage and bone will be removed and replaced with metal and plastic parts. These parts come in different sizes, and your surgeon will decide the best one for you. Knee replacements consist of the two metal parts that cover the ends of the femur or thigh bone and tibia or shin bone, as well as a plastic liner that fits between these two parts. In surgery, if the surgeon sees that the inside surface of the patella or kneecap is worn out, they will replace the inner surface of your kneecap with a small plastic button. When going through airport security, your knee will set off the metal detector. Tell them that you have had a knee replacement and they will ask you to go into the body scanner. You do not need a letter or card from your surgeon. You will not feel the weight of the replacement parts when they are in your body, and you will not notice the replacement knee getting hot or cold in extremes of weather. Your body will keep it at a normal body temperature. The metals used in the knee replacement are cobalt, chromium, and titanium. The liner and kneecap covering are a plastic called polyethylene. Knee replacements are cemented into place during surgery. Here we see the total knee replacement in place after surgery. The metal completely covers the ends of the bones. The plastic liner is not seen on X-ray. In the picture on the right, there are some small circles at the front of the knee. These are surgical staples, which is what the surgeon uses to close your incision. Here we see an X-ray of a partial knee replacement. With a partial knee replacement, only half of the knee needs to be replaced. Note the smaller replacement parts and the healthy cartilage on the left side of the knee in the picture on the left. Here we see a diagram of the total knee replacement on the right and a partial knee replacement on the left. A patellofemoral arthroplasty is replacement of only the joint between the thigh and the kneecap. Before your surgery, you will have an appointment with the Preadmission Unit or PAU. This is a medical appointment that is either done over the phone or in person. This appointment can take up to 2 hours. You may need to have medical tests such as blood work or x-rays done. You will meet with a nurse or anesthesiologist to talk about your current medications and medical problems. The plan for surgery and type of anesthesia that will be used will also be discussed. Please bring all of your medications as well as any supplements or vitamins that you are taking in their original bottles. Your medication may be changed after this appointment. Do not be afraid to ask questions at this appointment. This is the best place to ask if you have questions about your own health and your surgery. During COVID-19, this appointment may be done as a virtual visit. You will need to have access to MyChart for virtual visits. Please call the Ottawa Hospital to sign up for MyChart. Getting dressed will be more difficult after surgery. Bring loose-fitting clothing with an elastic waist to wear in the hospital. Stretchy material will be more comfortable. Supportive, non-slip shoes must be worn for walking. All toiletries must be unscented. It is a good idea to bring a notepad to write down any questions that you may have for the staff during your stay. Pack these items in an overnight bag, even if you are planning to go home the same day, just in case you need to stay in the hospital overnight. If you are going home the day of surgery, or if your surgery is at the Kemptville Hospital, please bring your walking aid with you to the hospital when you first arrive. Patients staying overnight at the Ottawa Hospital will not need to bring walking aids to the hospital. They will use the hospital's equipment. Wash your knee according to your surgeon's instructions. There will be eating and drinking restrictions starting the night before surgery. On the day of surgery, come to the hospital at the right time. You will see your surgeon before your operation. You will be given medicine to relax you and anesthesia. The operation takes 60 to 70 minutes. When the surgery is finished, and if you are staying overnight, you will be taken to the recovery room and then to your hospital room. If you are going home the same day, you will see the physiotherapist in the recovery room and go home from there. After the operation, you will wake up in the recovery room with a large dressing or bandage from your groin to your ankle. IV fluids will be connected at your wrist. There will be a small tube or catheter going into your knee joint to put pain medication inside of your knee. It is important to know what your knee will look like after surgery and to know that this is normal and expected. There will be a 20 centimeter long incision down the middle of your knee. It will be closed with staples. After surgery, the incision will be covered by a large bandage, so you won't see it. It is important to remove the bandage when you are told to do so. Checking your incision daily after the bandage is removed will let you see that it is healing well. Do not put any ointment or lotion on your knee. There can be a lot of bruising after knee replacement. You might see bruises on your thigh, around the knee, or in the lower leg and foot. Gravity causes the bruising to travel down the leg and into the foot. It will gradually go away on its own and does not need any treatment. Swelling is normal after this surgery. There can be a lot of swelling in the first few days. Some swelling may remain for 6 months or more after your surgery. Swelling can be managed with elevation and ice. Regular ice packs or frozen vegetables can be used. Be sure to put a cloth between your skin and the ice pack. Your surgeon may ask you to rent or buy an ice machine to help control your swelling after surgery. If you do get an ice machine, make sure you know how to use it before surgery. Your knee will feel warm to the touch. This is a response to healing and is normal. The warmth can last for several months. After a knee replacement, you will have some numbness on the outside part of your leg just below the knee. This is because the nerves that go to this area and are in the skin are cut when the incision is made. This numbness may be permanent and does not cause any problem. The numb area usually becomes smaller over time, but this can take up to a year. After surgery, the thigh muscle does not work properly for a short period of time. This makes it difficult to straighten your knee or lift your leg onto the bed. The physiotherapists and nurses in the hospital will show you how to get your leg into and out of bed until this muscle starts working well again. It will be important to use a walking aid during this time, as this is the main muscle that holds us up when we are standing. Many patients have difficulty sleeping after this surgery. Understand that it will get better. The first 2 weeks are the worst, but some difficulty sleeping can last for 3 months. Try to avoid taking sleeping medication, which can upset your normal sleep pattern. Sleeping too much during the day can also make it hard to sleep at night. A knee replacement is a mechanical device, and it is normal for it to make some clicking sounds. This is permanent. Knee replacement surgery is very painful. Dealing with your pain will make it easier to recover, and you will return to your normal activities faster. Your care team will ask you about your pain by using the pain scale. 0 is no pain, and 10 is the worst pain ever experienced. You should follow your medication schedule closely and stay on top of the pain. If you wait too long to take your pain medication, it can take a long time for it to start working. Over time, you will replace your prescription medications with over-the-counter pain medication like Tylenol. Pain needs to be managed with medication and other strategies to allow you to do your exercises and sleep better. Here are some things that you can do to help manage your pain. Support your knee. When lying down, it is better to have both your knee and foot supported on a pillow, so your leg is supported in as straight a position as possible. If the pillow is placed just under the knee for long periods, it will be very hard to ever get the knee straight again, even with exercise. The pillow should only ever be placed just under the knee when icing after exercise to allow you to completely relax. If you are sitting, make sure your foot is on the floor with the knee bent. Don't sit with the knee completely straight. This will make it very difficult to meet the bending goals. Regular icing and elevation with your knee supported will help to reduce both pain and swelling. If your surgeon has suggested that you get an ice machine, use it as instructed. Changing your position from bed to chair and regularly walking or moving the knee back and forth can also help reduce pain. It is important to understand that the knee is painful because of the surgery, and that as the knee heals, the pain will get better. Elevation can help reduce pain and swelling, but it must be done correctly. The knee must be supported with the feet higher than the heart, like the picture on the right. Sitting with your foot on a stool like the picture on the left will not work to get rid of swelling, and it may cause back pain. You can use pillows, a stool, or upside-down laundry basket to elevate your leg. Moving your feet up and down also helps to get the swelling moving out of your leg. There are no specific precautions after knee replacement surgery. Your new knee is cemented in place and it is solid. Putting weight on your knee for standing and walking is good. The physiotherapist will see you in the recovery room if you are going home the same day, or in your hospital room if you are staying overnight. They will teach you how much weight you can safely put on your affected leg. You will be able to put as much weight on your leg as you feel comfortable. You will need a walking aid because your knee will be painful and your leg muscles won't work well when you first start walking. You will learn how to transfer, which means to get in and out of bed and in and out of a chair. The physiotherapist will also teach you how to walk with your walking aid and to go up and down stairs. You will learn your exercise program. Following the program and exercising daily is a very important part of helping to make sure your knee works well. The focus of the exercise program is to improve flexibility at the knee and teach the thigh muscle how to work again. Right after surgery, your knee will have much less movement than before. You will have to work hard to regain your flexibility. When we heal from an operation, we heal with scar tissue. Scar tissue is normal. Right after surgery, the scar tissue is soft and stretchable. Over time, the scar tissue becomes hard like cement and it can't be stretched. Because of this, you must start your exercises immediately after surgery. You cannot damage your knee by stretching it. Remember, the replacement knee is cemented in place. Your medical team will be more concerned about your knee becoming stiff than about you damaging it in any way. You will need a walking aid after surgery because of the pain and weakness in your leg. The recommended walking aid is the walker that has the 2 small wheels at the front. This is a very stable walker that can be moved across the floor without being picked up. Crutches can also be used if you feel you have good balance and you have used them before. If you have stairs, you will need a cane ready for you when you return home. You will be taught how to go up and down stairs with a cane before you leave the hospital. If you are doing stairs now and have one healthy leg, you will be able to do the stairs after surgery. The cane should be adjusted so that the top of the handle is at your wrist when you are standing up straight. The cane is held in the hand opposite to the side of your knee surgery. You will not start walking with the cane until you start your outpatient physiotherapy. When you leave the hospital, you will understand your exercise program. You will know how to get in and out of bed and in and out of a chair by yourself. You will be able to walk short distances inside with your walking aid, and if needed, you will be able to climb stairs. If you are walking with a walker, you will climb stairs with a cane. If you are using crutches, the crutches will be used to climb the stairs. You will go home from the hospital when you are medically stable. This is usually 48 hours or less after surgery. If your surgery is at the civic or general campuses, the expected time for going home is 10 a.m. The person bringing you home from the hospital needs to bring your walking aid to you. You will need your walking aid to walk out the door of the hospital to your car. Campville Hospital does not have a set discharge time. The staff will tell you when you will be going home. You will have your walking aid with you in the hospital and will use it to walk to your car. If you will be going home the same day, your surgery will be first thing in the morning. You will see the physiotherapist in the recovery room before you go home. You must have someone stay home with you after surgery for the first 24 to 48 hours. If you live alone or you think you may need extra support after your total joint surgery, you may consider booking a stay in a retirement residence that offers convalescent care. This means going to a retirement home for a week or two where meals are provided and other services are offered. Patients are responsible for the cost of this service. The Going Home program is a service available to patients 65 years of age and over. It is a 10-day program of services to help you successfully return home after surgery. Services include transportation home from the hospital and 2 medical appointments, meals delivered to your home, personal care like assistance bathing and home help with things like laundry. During COVID-19, services are limited to meals and transportation. You will be referred in hospital to the program. You will be assessed by phone to determine your needs. There is no cost for this program. Follow these instructions to learn how to get into your car. Move the seat back as far as it will go. Recline the seat. Back up to the seat until you feel the back of the seat on your legs. Extend your operated leg. Hold on to the back of the seat and the car. Lower yourself to the seat. Slide back and lift your legs into the car. Park away from the curb. Practice before surgery. You will need to go to outpatient physiotherapy after you go home. The physiotherapist in the hospital will make the referral to outpatient therapy. You can go to any of the hospitals in Ontario or to one of our partner clinics for OHIP-funded therapy. Be prepared to tell the physiotherapist in the hospital where you would like to go. The referral for OHIP-funded physiotherapy will be faxed directly. If you choose to go to a private physiotherapy clinic, you will be responsible for paying for your therapy with possible reimbursement by your insurance company. If you choose to go to a private clinic, the referral will be given to you in the hospital and you will be responsible for setting up the appointment at the clinic of your choice. If your doctor or physiotherapist feel that you cannot attend outpatient therapy and need therapy in your home, they can refer you for a home care assessment. This would be a rare exception. The expectation is that you will attend outpatient therapy after your knee replacement. Outpatient physiotherapy begins 10 to 14 days after your surgery. The first appointment will be an assessment to determine your needs. The physiotherapy sessions are group exercise classes. You will meet with the physiotherapist in the class regularly to discuss your progress and to have any questions answered. You will be given information on when to return to your recreational activities. Your home exercise program that you do every day is the most important part of your physiotherapy program. You will be finished your classes when you have met the goals discussed in the next slide. On average, most people attend 2 one-hour sessions per week for 3 weeks. During COVID-19, physiotherapy sessions may be done virtually. Range of motion is the term used to describe the flexibility of your knee. A normal knee bends to 130 degrees. A knee replacement is not meant to bend as much as a normal knee. The goal in physiotherapy is to get your knee to bend to 110 degrees. This is enough bending to allow you to go downstairs normally and to ride a bike. Extension or straightening of the knee is to 0 degrees in a normal knee. The goal in physiotherapy is to get to -5 degrees or better. This means that if you were lying in bed, there would only be about 2 centimeters of space between the back of your knee and the bed. When these range of motion goals are met, you will have completed your physiotherapy program and you will continue your home exercises on your own. You will have an appointment to see your surgical team 10 to 14 days after your surgery. At this appointment, your wound will be checked and your staples will be removed. A bandage will be applied. You will need to keep your bandage on and your incision dry for 2 days. Your flexibility will be checked. If you are close to 90 degrees, you are doing very well. Your next follow-up appointments with the surgical team will be at 6 weeks, 12 weeks, 6 months, and 1 year after surgery. This is your chance to ask questions. Don't be shy. There is no such thing as a bad question. Remember to write them down and bring them with you to your appointment. Examples of questions are, when can I begin driving, return to work, or travel? This part of the presentation has been prepared by the Occupational Therapy Department. The goal of the presentation is to make sure you are prepared to manage your everyday activities after your surgery. You will need to think about how surgery will affect your ability to do your day-to-day tasks. What equipment will you need to have ready at home for you on your return? Are there any activities that you won't be able to do or need to do differently? Who can you ask for help? Your knee will require support after surgery. It is important to have a supportive chair with armrests. You will find it helpful to use the armrests to stand up from the chair. You will have difficulty getting in and out of a low bed. If your bed is very low, you may need to raise it temporarily. There is some equipment that you will need to buy or rent and have ready before your surgery. You can get this equipment by looking at the vendors list, through a local Civitan or Lions Club, or even Kijiji. Most people do well with a 1-month rental. You can pay for this equipment yourself or use your private insurance. You will need a prescription from your surgeon if you want your insurance to pay for the equipment. You can get this prescription at your visit with the surgeon after surgery. If you are on ODSP, they will pay for the equipment. If you feel you are going to have difficulty paying for this equipment, call the City of Ottawa at 311 and ask for essential health services. It is difficult to get on and off a toilet seat after surgery because of your knee pain, weakness, and stiffness. You will need to get a raised toilet seat or over-the-toilet commode chair temporarily to raise the height of the seat. Getting one that has armrests will also make it easier to get up from the toilet. 2 to 3 days after surgery, you will be able to shower, but don't immerse your knee in a bathtub, pool, or hot tub. It will be difficult to get into and out of a tub or shower after surgery. Equipment is recommended temporarily after surgery to allow you to shower while you are sitting. A tub transfer bench will allow you to sit down outside of the tub. Bring your legs into the tub and then close the shower curtain and have your shower sitting down. If you have shower doors, they will need to be removed and replaced with a temporary curtain while you are using the bath bench. If you have a walk-in shower, you can get an adjustable shower stool with non-slip feet. The following items may make it easier to dress and bathe if you can't reach your feet after surgery: a reacher, a long-handled shoe horn, sock aid, long-handled sponge, and elastic shoelaces. After surgery, you will be tired and won't feel like cooking. You will also be limited in what you can reach in your kitchen. You won't be able to reach into low cupboards or stand on a stool to reach into high cupboards. Keep items that you use a lot in easy to reach places. Plan ahead and freeze a few weeks' supply of meals before surgery. Consider home meal delivery services. Heavy housework tasks, including carrying a laundry basket, will be difficult for several weeks to months. Tasks requiring deep squatting or kneeling will not be possible or recommended. Consider having someone else do these tasks for a few months. These pictures show some things that will be difficult to do. You may need some help with these tasks for several months. Driving is usually not allowed for an average of 4 to 6 weeks after surgery. Things that affect your ability to drive are the use of narcotics, leg strength, and surgeon preference. Do not return to driving until your surgeon says it is okay. Check with your auto insurer to make sure you are covered. All patients that have had a knee replacement can use the Access bus system called Paratranspo. Instructions on how to download the application form will be provided to you. Fill out the patient section and bring it to the hospital. Your physiotherapist will complete the form and fax it to Paratranspo for you. Other forms of transportation include friends, family, taxis, Uber, and volunteer drivers from the City of Ottawa Community Resource Centre. It is each person's responsibility to think ahead and make the necessary arrangements to make sure you have a safe return home. This includes having the equipment ready that you may need to be comfortable. After a knee replacement, you will be expected to go home after 1 or 2 nights. If you think you will be unable to do this, please contact the Joint Replacement Team's physiotherapist at 613-738-8400, extension 82032. Think about short-term convalescent care. Before surgery, here are some things to do to make sure your home will be safe when you return home. Remove scatter rugs from areas where you will be walking. These are very easy to trip or slip on. Clear paths so that you can move around safely with your walking aid. Keep pets out of your way. Make sure that handrails along staircases and bathroom bars are securely attached. You will be taught how to go up and down stairs before you go home, so it is not necessary to set up on one level. If you do decide to set up on one level, it is important to make sure you have easy access to a bathroom, a sleeping surface that allows you to fully straighten your leg, a place to rest and elevate your leg, and a place for you to do your exercises. Make sure there is a safe exit from your home. The following exercises can be started today to help prepare for surgery. Try to do 5 to 10 repetitions of each exercise 3 times per day. If your knee pain or swelling increase, stop doing the exercises. Exercise 1. Lying on your back, bend the leg up by sliding the heel back towards your buttocks. Repeat 5 to 10 times. Exercise 2. Lying on your back with your legs straight, bend your ankle towards you and push your knee down firmly against the bed. Hold for 5 seconds. Repeat 5 to 10 times. Exercise 3. Lying on your back, tighten your thigh muscle and straighten your knee. Pull the foot towards you and lift your leg off the bed. Keep the opposite knee bent throughout the exercise. Hold 5 seconds. Repeat 5 to 10 times. Exercise 4. Sit on a chair or at the edge of the bed. Pull your toes up, tighten your thigh muscle, and straighten your leg. Hold for 5 seconds and slowly relax your leg. Repeat 5 to 10 times. Exercise 5. Sitting upright on a chair with the leg to be exercised supported on another chair, let your knees straighten in this position. Hold for 30 to 60 seconds. Repeat 5 times. From now until surgery, you can use ice or heat and elevation to manage your pain. Remember to stay active and keep moving as best you can. Continue with your present medical treatment, but this may change after your pre-admission appointment. Now we will summarize what you have learned so far about your recovery from surgery. There are 3 phases of recovery after a knee replacement. Phase 1 lasts from the day of surgery until 6 weeks after surgery. During this time, you will follow the instructions given to you in the hospital to look after your incision. Do not put any creams or lotions on your incision. If you are going out in the sun, the incision needs to be covered. You will have swelling and bruising in your knee and lower leg, and you will use ice and elevation to keep these under control. You will manage your pain using your medication and other management tips mentioned in the presentation. Expect that your sleep will be disturbed. Avoid taking sleeping medications and understand that it will get better. You will have difficulty moving around and you will use your walker or crutches to help you. Your leg will be weak and your knee will not bend or straighten fully, but you will be doing your exercise program daily and this will get better. Phase 2 lasts from 6 to 12 weeks after surgery. You will find that you continue to have swelling and your knee will feel warm and stiff. This is normal and will improve for a full year. You will now manage your pain with over-the-counter pain medication like Tylenol. Your flexibility will increase and you should be meeting the targets for your range of motion. The goal is lacking 5 degrees of straightening or better to 110 degrees of bend. If your knee was very stiff before surgery, you may not fully meet these targets. You will find that your strength has improved, but you may still notice weakness in your legs when getting out of a chair or climbing stairs. Your strength will improve for a full year. You will find that your mobility and walking have improved and that you have more endurance and can do more around your home. Phase 3 lasts up to a full year. You will see slow and continued improvement. There will be less feelings of stiffness and less pain. You will return to your work and recreational activities. Always put sunscreen on your incision if going outside in the sun. It is normal to continue to have some feelings of stiffness at the knee. The area on the outside of the leg may be numb. Your knee replacement will not bend as much as your other knee, and you may have some discomfort when kneeling that never goes away. After viewing this presentation, you should have a plan for how you will get home from the hospital and to and from your medical appointments. You should be thinking about how you will get your meals. You should start considering what pieces of equipment you will need and how to get them. You have decided on where you will attend physiotherapy after you go home. Are you going to have someone help with your housework, and are you going to change your home setup? Are you considering convalescent care? We know that this can be a difficult time for our patients, but we want you to know that the staff and doctors at the Ottawa Hospital are committed to providing you with the compassionate care we would want for our loved ones. Thank you for watching the Ottawa Hospital's knee replacement presentation.